Hi, I have my friend Loretta behind me, and she has agreed graciously to help us out today with being able to demonstrate a pelvic floor balance. Just previously, I had her do some pre-checks. We've already done a Touch for Health 14 muscle balance, so we know that the muscles are strong. Also, we did the muscles that are also in the 42 muscles, so they're ready to work as surrogates as well. And I asked her to use the restroom, stop midstream to see if there's any problems, and there weren't. I asked her to do a Kegel and see if there was any discomfort, and that was fine. I asked her to walk around and notice anything in that pelvic area, and she was good with that. She did mention a little bit of a pelvic tilt on which side was that, Loretta?
The right.
The right side. And so we can check that out at the end as well. And she really doesn't have any problems with urgency or any of the other things we've talked about. So we're just going to get started. I have this paper that you have received with the journal. And so we're just going to go down on this chart. Now, unfortunately for you, fortunately for me, when I turned my paper in, I really didn't have them in the ideal order. I have mine in an ideal order now. You'll have to just make some arrows and switch them around when you do this balance yourself. All right, the first muscle we're going to do is the bulbospongiosis. So we're going to use the adductors for that. And first of all, and like I say, I've already done a Touch for Health balance, but Loretta, is it okay if I touch you?
Absolutely, yes.
Okay. If there's any discomfort that is not okay with you, the magic word is stop.
Okay.
All right. So we're going to start with the adductors. We're going to bring the feet in, and let's go with the right. Let me just show you the range of motion here, like this.
Okay.
And so we're going to ask the right adductor is ready, willing, and able to stand in for the bulbospongiosis. Hold that. And it says, yes, it is, with a switch down response. So the next thing is, okay, it is now standing in for the bulbospongiosis. Hold. And that looks good, all right? And then for the second one, her body's kind of knowing what we're asking, so I'm just going to say on the left side, bulbospongiosis. Hold. Okay, so we've got a little bit something going on the left side, so I'm just going to mark that down on my chart. And adductors. So let's do fix as you go. So we're going to do the neurolymphatic points for the adductors here. And in the back, right at the end of the scapula. All right, and let's recheck that bulbospongiosis. Hold, and that is good. All right, next muscle. That is the coccygeus. Coccygeus. Yeah. Gluteus medius. We know that muscle. So bring the right one out. The right gluteus medius is ready, willing, and able to stand in for the coccygeus. And it's solid, and it is now standing in for the coccygeus. Hold. And that's good to go. Okay? Coccygeus. and and the left. All right. So gluteus medius, what I'm going to have her do is put her hand on your pubic bone, and then I'm going to rub where her hand is to get, without breaking her fingers. This is kind of a good way to do these areas. And then you can take your hand off and I'll do the back points. And let's check it out again. All right, so hold that. And that's strong. Good to go. All right, next one is the external anal sphincter. And we're going to use the supraspinatus for that. And I've got the diaphragm on there because sometimes that one works as well. So let's ask the body. The supraspinatus is ready, willing, and able to stand in for the external anal sphincter. Hold. Nice. The left supraspinatus is now standing in for the external anal sphincter. Hold. And that's good. All right. The external anal sphincter. Turn just a little bit. There you go. A little bit there. Okay, hold that. And that's great. So we don't have to do that. If we did, we would use the points for the supraspinatus. And also, you know, we could also use the neurovascular holding points on the head, or we could run a meridian. We could use the acupuncture holding points, whatever we need to do. For the supraspinatus, and that'll send energy to the external anal sphincter. So the next one is the deep transverse perini. And we use the gracilis for that. So let's see, I'm going to have you bring your legs together, bend this knee just a tad and drop it out a little bit, and then put it over onto this other leg. Good. Now, and then drop it out a little bit more, and then I'm going to bring the foot out and the knee over. Okay, so the what are we working on here? The deep transverse perini. The gracilis is ready, willing, and able to stand in for the deep transverse perini. Hold. And it is. It is now working as the deep transverse perini. Hold. And that is good. Let's check the right one. Okay, good. And flop that knee a little bit. This is the deep transverse perini. Hold. Nice. Okay, so we don't have to do any work there. If we did, we'd work the points on the gracilis. And now we're working for the superficial transverse perini. And we're using the piriformis. So we're going to have you bend your knee and then move your foot exactly, just like that. And so I'm going to bring the foot back this way, and the piriformis is ready, willing, and able to stand in for the superficial transverse perini. Hold. It is now standing in for the superficial transverse perini. Hold. All right. So that was good. Let's check. Let's check this one. Superficial transverse perini. Hold. That one's a little harder, isn't it?
Yeah.
Okay. So that is right. And for this one, I'm going to have you hold your pubic bone again. And we're just going to rub there. Now, I could have her hold her own, you know that, but sometimes people just don't get in there as firmly as I like to work. Sometimes you have to do it firmer. All right, let's try this out again. Superficial transverse perini. A lot better. Mm-hmm. Yeah. Yep. Okay. All right. Now we are at my favorite, ischiocavernosus. Ischiocavernosus. Beautiful name. You could name your firstborn that, right? Here's my son, ischiocavernosus. Gluteus medius is what we need. So what I did in this, I put the ones where we're going to turn her over on the other side at the end. We're going to work with the gluteus medius here. Got her turned over, and I'm going to have you lift up. And the gluteus medius is ready, willing, and able to stand in for the ischiocavernosus. Hold. It is now standing in for the ischiocavernosus. And that is good. So then, let's do the left one. Ischiocavernosus. And that seems good. All right. So next are the hamstrings. Levator ani. So we'll start with the right. The right hamstring is ready, willing, and able to stand in for the levator ani. Hold. It is now standing in for the levator ani. All right. And that felt good. Let's check this one. The levator ani. Hold. Okay. And we've got one more. The external urethral sphincter. And we're going to use the sacrospinalis for that. External urethral sphincter. Loretta, I'm going to have you put your hands back here, and then I'm going to have you lift your head and your chest up and turn toward me like that. And this side stays down, and turn as much as you can. And the sacrospinalis is ready, willing, and able to stand in for the external urethral sphincter. Hold. It is now standing in for the external anal sphincter. Hold. Nice. Okay, now I'll let you rest a minute. And she's strong like bull. Okay, now I'm going to have you do the other side. External urethral sphincter. Hold. And that is good as well. All right. We've done the balance. It didn't take that long. She didn't have that many muscles switched off. So now we are just going to make a global statement about all of the muscles, and I'm going to like this and say, all the muscles that we used for surrogates can go back to being themselves. They are now themselves. Hold. Yes. We can even do that with the legs because we were working with the leg muscles. How are we going to do that? We can have the leg muscles are all working as themselves. Hold. Leg muscles are all working as themselves. Hold. And also, if you forget, most of the time intention is good enough, but you know, it's good to remember to just make sure everything is back the way you found it.
I feel relaxed.
Okay,
I feel more relaxed.
Okay. Yay. So, yeah, when you focus on that area, you feel more relaxed.
Mm-hmm, mm-hmm.
Okay.
And like it's even holding me a little better.
Okay. You know, on that left side, do you notice any difference in that tilt you
I normally can't feel it too much unless I'm laying on a hard flat surface, but yeah, even going back and forth, I feel it does feel a little straighter.
Yeah.
Yeah, they're both tilting equally, it feels like. So, and the low back feels better.
Cool. All right. So, like I say, she, well, one thing I didn't ask you is, do you get up multiple times to go to the restroom in the night?
Usually twice.
Twice. Okay.
Mhm.
Well, take note of that
Okay.
and get back to me before Friday.
Okay.
And
Okay.
see if maybe that urgency then hasn't changed much.
Okay. Okay.
Yeah.
Yeah. It's usually twice.
Because Loretta hasn't. She's 62. She's kind of young, but there are a lot of people that are 62 that do have more problems. But she doesn't have a lot of problems in that area. But she offered to help out, and I needed her help